Hello, welcome to AMDA on the Hill, your periodic update on AMDA's work on public policy. My name is Alex Bardakh. I'm the Director of Policy and Advocacy here at AMDA. Just a couple things since we had this last update, and first and foremost, of course, the thing that has been dominating the headlines is the spread of the coronavirus or the COVID-19. AMDA has been at the forefront of providing information, timely information on what is going on. We have provided information on our website, some clinical guidance. We have partnered with the Washington State chapter to provide a webinar. Of course, as you all know, unfortunately in Washington there has been a nursing facility that has had deaths from the spread of the COVID-19 virus. So we want to make sure that we do everything possible that people understand what they can be doing, what they should be doing, and while the threat remains low from the CDC and we want everybody to be following the CDC guidelines, we want to make sure that you're educated, that you know that there are resources available, that you educate not only yourselves, but the facilities you work in, the public, so that everybody understands what you need to be doing in order to prevent the spread of COVID-19 or the coronavirus. A couple of things from the public policy front related to the coronavirus. Just recently, the Centers for Medicare and Medicaid Services issued an announcement, pretty unprecedented, that they are suspending some of their survey activities and will be refocusing their efforts. Seema Verma, as well as Vice President Mike Pence, issued a statement that they will be refocusing their efforts and they will really be looking at things that are immediate jeopardy, but they will really focus on infection control efforts within nursing facilities and, of course, and other healthcare settings as well. The goal of this is not to be punitive, as has become customary of many of the surveys. It's not to be punitive. It's to ensure that there are proper protocols in place for infection control to ensure, of course, that the virus does not spread. We know from at least the reports thus far that the most vulnerable population are the elderly and those with respiratory issues. And of course, given the nature of residents and patients in nursing facilities, that is a majority of patients. So we want to make sure that everybody understands what's going on and avail themselves of the resources, both, as I mentioned, from AMDA and now from CMS. Congress has also reacted to this, of course, and they held some hearings. Just recently, the Appropriations Committee has released their funding effort for the coronavirus. There was a deal reached in Congress for a $5 billion package, but also within that, importantly, there is a $500 million provision for telehealth, and they are relaxing some rules in terms of originating sites, that you don't have to be in certain geographic areas in order to take advantage of those telehealth rules. Of course, AMDA is inquiring with CMS what that means for post-acute and long-term care. There are certain restrictions, as we've talked about before, in terms of once-a-month visits and other things, but we certainly encourage you to do everything possible to either use telehealth or other means to see patients, to be part of the conversations, to prevent the spread of COVID-19 or the coronavirus. Those are some of the things that have occurred. Of course, this is an ongoing situation. It could change daily, it could change weekly. We will continue to provide resources as much as we can. We have mentioned on several calls and in the media the need at this point for a medical directory that we've talked about before, because we certainly encourage our medical directors to be involved in this conversation, and we do feel like they play a very important role in what's going to happen in the weeks and months ahead in terms of containing and making sure that the virus does not have devastating effect, which could potentially happen, but certainly at this point is not what's being predicted. There are, of course, other issues going on other than the coronavirus, and we continue to work on those as well. One thing that happened from the last update is an AMDA team, myself, Chris Laxton, our CEO, and a couple of our physician leaders met with the Drug Enforcement Agency, of course known as the DEA. You may ask yourself, why in the world is AMDA meeting with the DEA? And that relates to an issue that dates back to 2008 and the DEA enforcement of something known as the nurse agent issue, dealing with prescribing of Schedule II controlled substances. Back in 2008, the DEA started enforcing this rule that a nurse could not act as an agent of the prescriber, which led to some issues in terms of workflow, in terms of getting these drugs in a timely manner to the patients. And over the years, we've talked about this, and we have had a number of legislative efforts. We've had a number of regulatory efforts to try to solve for this problem, to improve the workflow and reduce the administrative burden that's involved in prescribing controlled substances. The meeting with the DEA was called by them, and they believe that they have certain solutions that they discussed with us. The details of that is not yet available, but we had a very good conversation, and we feel that there will be some proposed rulemaking later this year that will be written on paper. We feel it will be favorable to the workflow of the clinicians. We feel like it will reduce administrative burden and improve patient care. So hopefully we will see some movement, of course, after more than a decade of dealing with that issue. Of course, since that point, e-prescribing has changed the landscape quite a bit. But hopefully this will provide yet another option for those that are still struggling with this issue. And we certainly have heard that a number of clinicians still struggle with the issue of prescribing controlled substances in nursing facilities. So that is one of the issues that we continue to work on. The other issue that we've discussed a number of times in these updates is congressional action on the role of antipsychotics in nursing facilities. We continue to meet with Capitol Hill and the committees of jurisdiction to discuss alternative approaches in addition to or supplemental to the work that's ongoing at CMS with their dementia initiative. This has to do with perhaps revising the measure to ensure that it is more robust, to ensure that there are no gaps to where appropriate antipsychotics are not being prescribed because of fear of losing star ratings. And so we continue to discuss what type of quality measure would be more appropriate than what is currently available under the 5-star rating system and the initiative. Speaking of the initiative, the goals for the initiative are set to sort of run out, and there's now ongoing discussion about what's next. So AMDA will be participating in those discussions with CMS, parallel to the effort on Capitol Hill, in terms of what's to come of the dementia initiative and what goals need to be set further down the line. Perhaps it'll be revised. Perhaps we'll be looking at a different measure, but that's something that we will continue to work on. I think those are the big legislative issues and regulatory issues of the moment. Of course, a lot of airtime on Capitol Hill and, of course, at CMS is being dedicated to what's going on with the election. It is getting to us ever closer, and as the election nears, people sort of start to wrap up some things that they've worked on a previous administration, trying to figure out where it's going to go in the future. So a lot of airtime, of course, over the summer and in the fall will be spent figuring out where, and depending on how the election turns out. We're monitoring that. There are issues that we're looking at, whether long-term care financing, whether long-term care issues are being addressed during the presidential election, and that's certainly something we hope that will be debated and discussed as the election process moves on. That's it for now, and hopefully we'll see you shortly. Thank you.